So we have a wonderful patient discussion panel here with three patients who are very, and we're very happy to have today. First, we have Suzanne Lescure. Thank you. And Marla Avery. Yeah. And Ted Popp. All right, great. How do you guys want to do this? Do you want to, each maybe tell a little bit about your story, and then we can open it up to the group then?
I said to put together like a 30-minute presentation.
30-minute presentation each.
Yeah, right.
Is that right, Grant?
Marla's first.
Okay, maybe 10 minutes. Okay. Great, thanks.
Yeah. Bless you.
My name is Marla Avery, and my journey started with a trip to the optometrist in 2008. I was having distorted vision in my left eye, and he sent me to a retina specialist, and he told me in a casual conversation that, Miss Ellis, you won't be having surgery today. That's the good news. The bad news is you have cancer. So I said, may I sit down? And he said, sure. And he left the room. Well, my heart stopped, and I gathered myself up, and I called all of my family. And I thought, did he just say what I thought he said? Let's see. We went the next week, and I had a second opinion. As we sat in the waiting room with my fiance, he read on the wall, if the mass is too big, they'll have to remove your eye. I just got sick. We met with the second doctor, and he said, I think your eye might need to be removed, but we can do plaque therapy. So we left that office, and then my dad called me and told me that his secretary, as uncle, had ocular melanoma, and that MD Anderson saved his life. So he told me that he could get me in touch with them. Well, my sister and I had a friend that worked in MD Anderson, and she helped me get in. So the next week we were off to MD Anderson. I say God always puts people in your path for a reason. Within a week we were Houston bound. I then met with Dr. Dan Gonsalves and his team for the first time. As I sat and listened to every word that Dr. Dan Gonsalves had to say, and all I heard was the mass is too big and your eye needs to be removed for survival. Dr. Dan Gonsalves had confirmed my worst fear. I was fighting back the tears. I had scanned the room at everyone's reaction, catching my dad's eyes as him nodding yes. I knew then it was going to be the best thing, but I didn't have to like it. On August 9th, 2008, my life changed forever. Dr. Gonsalves removed my left eye. The morning after surgery, my dad, sister, and her husband, Jason, came in for the next shift. I will never forget that day because those who've had your eye removed know that it's not the best feeling. But all I could hear was a paper sack crunching to my left side. And then they pop up and appear in pirate outfits.
That's cute.
And the big joke before surgery was that I would become a true pirate. And it was priceless because I will never forget my dad being Jack Sparrow. The next appointment with Dr. Gonsalves would be the hardest day of my life. Dr. Gonsalves' fellow took the cast off my eye. I honestly didn't know what to expect. I was so thankful that my mom was there with me. The first time I saw my new eye, I freaked out. in sobbing tears. I can remember being very weak in the knees and almost passing out. I thought, how is the man that I'm going to marry going to love me? You see, Stephen always told me, it's not your heart I'm seeking or what you can do for me. It is your heart I'm seeking, I'm sorry. It's not what you can do for me. Hello, it's your eye. No. Put it back in, Dr. Gomez. No, I'm kidding. After 2 months, I got the green light and I flew down to see Dr. Gombos to make an appointment for my new eye. I was praying to see Dr. Tronics, and if he could work a miracle. I had been in the cosmetic industry since 1991. I was all about helping people feel beautiful. I wasn't feeling like I could go back after my eye removal. Who would listen to me? There was a day in October that changed my life forever. Stephen and I walked into Mr. Tronick's office. I couldn't get there fast enough. We went in at 9 a.m. that morning, and Dr. Tronick's worked his magic. At 6 p.m. that afternoon, I had a beautiful new eye. He is a true artist God has given a true gift. Not only did he make my eye, he helped my soul. I was walking on air with my left eye that Mr. Tronics had made. He will never know what he did for me that day. When we got home, I was showing off my new eye, and my mother-in-law, Devise, said, Marla, if I knew that this would have made you this happy, I would have whittled you one. And she is an amazing soul who's done so much for me, and I love her dearly. For a short time, I did return to the cosmetic industry, and after I received my eye, let me just say, God gave me the gift of telling my journey and showing people beauty comes from His grace. On October 2009, 7 weeks after my daughter was born, Dr. Gombos' nurse called me and broke the news. My cancer had returned. It had metastasized to my liver. They found 3 tumors. I thought it was a joke. Since my removal, I had married, just had a baby, and life couldn't be better. Then someone tells me my cancer is back. This was a moment that stopped me dead in my tracks. The nurse scheduled me with Dr. Wen-Jin Hu and assured me she was the best in her field. All I could think while waiting to speak with Dr. Hu was, I can't die. I have a beautiful life, and it took me a long time to get here. All I could say was, Lord, I want to live. Please show me your mercy and grace. We went to see Dr. Hu for the first time. She was up front with me in my diagnosis and the seriousness of the tumors. She said we needed to take action. We went home to discuss the options. 2 weeks later, Stephen and I were back in Dr. Hu's office. And I looked at her and I said, do everything in your power to save me. Dr. Hu told me the treatment she thought would work for me. And she said it was chemo catheter embolization, which was targeted therapy to the tumors. I had been praying with many and been prayed over by the elders of the church. We prayed that God would be over my doctors and her team that made decisions on the right treatment. But with cancer of any type, it is a hit or miss when trials are involved. I had decided that the Lord had this. I was going to use every inch of faith I had to get me through this. I had a husband and a baby to fight for, so the second of my cancer journey began. It says in 1 Peter 17, these trials will show your faith. is genuine. It is being tested as fire tests and purifies gold. Though your faith is far more precious than mere gold, so when your faith remains strong through many trials, it will bring you much praise and glory and honor on the day when Jesus Christ is revealed to the whole world. November came before we knew it. Next, I was set up for 8 treatments of hepatic arterial infusion with Abraxane. I had reached the maximum level of treatment for me. Therefore, on my 9th treatment, I had radiofrequency ablation, followed by doxorubicin beads. After the procedure, I had a TIA. Let me add, during these treatments, I will forever be grateful for the people who took care of my daughter, Lainey Webster, and her family, because as caregivers, we're so focused on us as the patient, sometimes we forget to say thank you to the ones who take care of our family. So thank you, Lainey, and my aunts, and Aunt Laura, Stephanie, and Carrie. You will always hold a special place in my heart. I was fine, and my next checkup proved no evidence of disease. I had clear scans from August 2010, and then the day came, January 24th of this year. The cancer returned for the 3rd time. It was one small tumor on my liver. Dr. Hu and Dr. Sanjay Gupta decided radiofrequency ablation was a good option. I prayed about it, and I was all in. I knew who was carrying me. I thought to myself, God, if you are using me for a reason, if there is just one person to share your mercy and grace, I'm all in. As it is written in Colossians 4:3-6, and I pray for us too, that God may open a door for our message so that we may proclaim the mystery of Christ, for which I am in chains. Pray that it may proclaim it clearly, as it should. Be wise in the way that you act towards outsiders. Make the most of every opportunity. Let your conversation be always full of grace, seasoned with salt, so that you may know how to answer everyone. I am not wasting my cancer, as I hope you aren't. What I mean by this is that I could have given up or given in, but that would have been the easy way out. I have been blessed with this life, getting to share my journey. Just this past May, MD Anderson Melanoma Department selected me as one of the patients of the year. I got to speak at the walk and was encouraged by the doors it opened. Last week, I went to Nicaragua on my first international mission trip, and now I'm here with you. I have one blessed life. Had I not had cancer, yes, I may have had a good life, but I'm not wasting this one, and I am grateful for this journey. Thank you.
All right, Ted, do you want to go next?
Yeah. I apologize in advance. This first part of this thing is kind of dry, but it's a journey we've all been through. 3.5 years ago, I was diagnosed with uveal melanoma, and that same week went to Dr. Shields and had it treated with radioplaque. We chose to have the genetic testing, and then sure enough, in 3 months, we found out that I was at high risk with monosomy 3 and 8q amplification. I had my initial scans and had an appointment with Dr. Sato in November and decided to start taking Sutin as an adjuvant treatment and ended up taking it for 6 months. Approximately 1 year after my tumor was treated, scans showed that I had a handful of sub-centimeter sized liver lesions, and retrospectively these lesions were also identified in the scans from 6 months prior. Basically tried to do a fine needle biopsy, wasn't able to be done because it was very small and deep. Basically waited, knowing that I was probably going to have to do liver-directed treatment, had my gallbladder out. At that time, they tried to do a biopsy laparoscopically. Again, it was too small. And finally, we decided to wait 2 months, and then basically 2 months later, we performed another set of scans, and the tumors had grown of sufficient size to where we could do a core biopsy, and then pathology confirmed that it was metastatic uveal melanoma, and of course, that starts your journey through the various treatments. 2 years ago, I had SIR spheres to my right lobe, which provided good efficacy for about 9 to 12 months. My left lobe was unable to be treated because of anatomical issues. About 6 months later, I participated in a systemic trial using IMCA-12 for about 4 months because of a suspected lesion that was growing outside of my liver. The drug probably had no effect on the tumors. About 6 months after that, which would have been a little over a year ago, because of tumor growth in my liver, I started the liver-directed immunoembolizations, which I did through January of this year. And those would have been done at 3 to 4 week intervals. Then because of continued growth of the tumors in my liver, we decided to switch over to chemoembolization. But first I had dead-dox beads in my left lobe since it had never been treated with SIR spheres. The dead-dox beads were effective. I've now been doing chemoembolization since the beginning of this year, separated by 3 weeks at a time, but now at intervals of 6 to 7 weeks, and so far I've been stable, and I'll find out on Monday if things are still continuing to go well. The only other treatments I've undergone was at the beginning of this year. A tumor was identified in my portocaval lymph node, which is basically right here in the middle, and I had it treated with a CyberKnife, and subsequent scans showed that shrinkage of that tumor. And I do have small bone mets, and I basically have had monthly infusions of Zometa for the last 12 months. These treatments are probably typical of what many others have experienced, although the order might be slightly different. In the case of the liver-directed treatments, what initially may seem daunting becomes very routine and has little impact on your daily life between treatments. Although between travel and treatments, it can be time-consuming, I fortunately have tolerated all the treatments very well and have continued to have a good quality of life and remain active. The main side effect has been occasional fatigue, but the most effective way to fight fatigue is through rest and exercise. And quite honestly, the only thing I have really to remind me of anything at home that's supposedly maybe cancer related is on my bathroom mirror at home. I have a note that simply says, "Eat right and run." Keep it simple, and that's all I do. When we first found out that I had uveal melanoma, my son was about to turn 15 and my daughter was 24. We chose to communicate openly and honestly about what this potentially would mean, and in our case, it has proven to be effective in helping our family accept what it undeniably is going to be a grim prognosis. After each change in condition, I would communicate the facts to our children and other family members and would also communicate via email so they could digest it later. When I was originally diagnosed with my eye tumor, and again when metastatic disease had been confirmed, I communicated there were few treatment options, and the ultimate prognosis was grim, and that no amount of dwelling on those facts would change the outcome. It was especially important to communicate this to my parents, since my sister died 10 years ago at the age of 38, completely unexpectedly of a cardiac arrhythmia. Over the last 3 years, we have been successful in not letting the cancer run our lives. We live our lives like we normally would have, and we've created memories through additional travel that we might not have otherwise taken. Being realistic about my situation, I think, is key to feeling more control of your life. I will stress again that the liver-directed treatments, not that there are many alternatives, but have allowed me to stay active and see my son graduate from high school, start college, have his first girlfriend. You know, we've taken family trips to Vegas where Connie and I and my kids, we went to the little chapel and got our vows renewed. And we've taken various trips that include hiking, snorkeling, and snow skiing. And I guess what I just want to stress is that I know there's half of y'all here that are, again, have not had metastasis. And I hope to God that y'all never do. But if you did, like I said, one of the things that I'll just stress is that really it is not, the quality of life has not been affected at all. And that's very important because, like I said, we've been able to continue to just basically live our life normally. We took a proactive approach to research what treatment options were available, and we were active participants in discussions with doctors. We are not passive in our approach. For example, I have, and I would stress that everybody always get copies of and review your own radiology and lab reports. Unfortunately, the one time I did not do this was while I was on that IMCA 12 trial. And to be honest, the information that I was being told by the doctors was incomplete. And probably if I would have been reading the lab report, the radiology reports like I always had in the past, and due to this day, I probably would have removed myself from that trial earlier and started some other treatment like immunoembolizations. And again, whether that would have affected the ultimate outcome, who knows. As another example, when I went to consult for radiation treatment on that lymph node, I also have another mass that's been there for 20 plus years that is not a tumor or anything, it's just a mesenteric mass, but they had developed a whole radiation treatment option for that mass and not the lymph node. So again, I'll just stress that it's always important to be actively involved in your treatment. Anyway, the other thing I would say is that we've obviously been through, again, like several people here that have the metastatic disease, you've been through a lot of different treatments. And I'll stress that everything will not go as planned, and you should expect there'll be bumps along the way. But again, I don't want to say it's not a big deal, but it's just something to expect, and it doesn't have to affect your life or how you view this. Just some examples that we went through is that when I originally had the biopsy, of course it was small, we tried, it was too small to get to, had to wait a couple months, did another biopsy. When I did SIR spheres, my anatomy on my left lobe didn't allow part of the arteries to be cut off, so we only did the right lobe, but that's where really the only couple of tumors were, no big deal. When I did the CyberKnife radiation, they basically go ahead and they stick these markers in here, and they go through your liver through 7 inches, and they stick these markers in here. First time they did it, they couldn't use it. Next time they put 3 of them in there, still couldn't use them. And then I found out today, which I thought was very interesting, and this is another thing where to let you know that you should always go ahead and be doing your research, because even some new information came up today. But originally when I was going to do that CyberKnife, I have all these coils in my liver where they use to cut off the arteries. A doctor, when I originally was going to have this performed, the doctor suggested, hey, I can see these coils, can't you go off the coils? The radiation oncologist said, no, it needs to go off of the gold markers. Well, today we heard that Dr. Ane said that they can sometimes use the coils to actually do their treatments off of. So again, you will always have road bumps. I mean, there will always be little bumps in the road. There will always be new information coming out, and sometimes it'll contradict what you've probably heard in the past, but honestly, it's just part of the journey. And the thing you got to really, at least we've tried, is that not to let it affect our how we continue to live our life. So.
Hi, I'm Suzanne Lescure, and I was first diagnosed in 2003. I had a flesh-colored tumor on my eye, and my ophthalmologist said, oh, it's a pterygium, it's 99.1% benign. Well, he removed that, and the next day, or two days later, he called me and he said, you have malignant melanoma, according to your pathology, and I can no longer see you. So I was referred to an ocular oncologist in San Francisco, and he diagnosed me with the conjunctival melanoma, and that's how it appears on the surface of the eye. So I was able to see it, unlike uveal melanoma where you can't always see it, I could see it visibly. And so I was seeing my doctor in San Francisco, and every time the spots would appear like this over different parts of my eye, he would remove them. He'd freeze them, and he would just remove them as they came up, and that was every 3 months. So it went like that for 3 years. I had surgery like every 3 months to have it removed. And then in 2006, I felt a lump underneath my jaw, and I asked him, I was due for another surgery, and I said, when I'm in the OR, can you do a fine needle biopsy on this and see what it is? And he said, oh yeah, he could do that. He did it, and it came back negative. However, it was still there a week later. And then at that time, I had to go for the fine needle biopsy awake, which was pretty painful. And that turned out that it was positive for melanoma. So this particular melanoma is totally different from uveal. It behaves just like skin melanoma. And so, so when I had a radical neck dissection, and then unbeknownst to me at the time that I had that, I also had a spot on my lung. So that put me to stage 4 cancer. And so my case went before the tumor board in San Francisco, and a bunch of doctors, they would confer over, what to do with me, how to treat me. And what they came up with was chemotherapy, which was biochemotherapy and high-dose interleukin-2. And it's a very, very toxic treatment, and you can only have it in a hospital setting. So I would go for 6 months, I would go every 3 weeks to be put in the hospital for 5 days while I would have this continuous infusion of chemotherapy and immunotherapy. And I was sicker than a dog. And I should say, when they came and told me that I had stage 4 melanoma, the doctor also said, oh, and if you don't do treatment, this is the only thing we have for you, the only treatment option. Otherwise, you have 6 to 9 months to live. And I just lost it then. But then I started, feeling myself get kind of angry, and kind of like get fierce about it. It's like, no, damn it, I'm going to be here. I'm going to fight this. And so I did the 6 months of biochemotherapy with the interleukin-2. Then when I was done with that, I had to do the interleukin-2 for a whole year, be in the hospital again, but 3 days this time every month. And so I just withstood that as best I could. It's a toxic treatment. It makes you really super sick. But I was a total responder. The interleukin-2 and the biochemo, it completely shrunk my lung met completely away. And so then after that, just a little while after that, I had no recurrences in the eye, of course, during that time while I was having that treatment. But then I started getting the pigmentation again, except now it was on the eye, but it was also on my eyelid. So I talked with my ocular oncologist, or not my ocular oncologist, my regular oncologist, and he said, I think the best course of treatment for you would be to remove your eye and your eyelids. So, I had to digest that, but then I thought, I've hit stage 4 cancer, and I don't want to just keep having surgery and go stage 4 again. So, so then, where's Coriel? So then I decided to have the surgery to have my eye and my eyelids removed. And I had it done here at Jefferson. And leg. That's where they took my graft for my eye cavity to cover the hollowness, where everything was. And they took a really big piece because they have to do it so that the vasculature will match up and that it'll have adequate blood flow. And I had this big old piece of skin cut off my leg, and that was the most painful part of it, even more painful than the eye itself. And so then, the next page. The picture on the left, that was me after I got released from the hospital. That's how far out it stuck out. I don't know if they put packing behind there or what they put behind there, but I had to take the arm off my glasses, and that was hard because, my glasses wouldn't sit right and I was getting dizzy and everything. But, and then after that, I have had 2 more surgeries. I had to be debulked, is what they call it. They take the bulky mass off. So I came back here to Jefferson and had that done. And then my next operation, I got titanium rods. And there was a gentleman in the audience that was asking about accentuation. What is that? And I was going to show you. This is what it looks like. That's my eye cavity and my eye. It has magnets on the back, and I just, put it on here. And so I had a really great artist. He's called an anaplastologist, and he makes the piece out of silicone. And I don't know what the actual eye is made out of, but the outer parts are silicone, and he's just amazing. And I have brochures. If anybody ever thinks they're going to have an exenteration, he would be the guy to go to. But I've tried to keep positive through all this, and I call it every day bonus time. And like Ted said, I was here to see certain milestones of my kids, and that's what was the driving force at keeping me with a positive attitude. It's like, I need to be here for this. I want to see my kids graduate, I want to see them be successful adults, and I've been able to do that. And when I turned 50, my daughter threw a party for me, and she made me cry. She said, this is really special because my mom wasn't even supposed to live to see 50. I was 43 when I was first diagnosed. So that was a big milestone there. And I just try to remain optimistic, and I call every day bonus time. And but in December, it will be 7 years that I've had no evidence of disease. Thank you.
Thank you so much for sharing those stories. That was really special. And I want to just see if anyone has some questions. We have time, maybe about 7 minutes for questions.
Ted, were most of your treatments done at the same place?
Yeah, actually, all my liver-directed treatments have all been done here at Jefferson. CyberKnife was done in San Antonio, and the IMC-HL trial was done in MD Anderson.
I just want to ask, during this period of years when you were treated and were going back and forth here and there, were you working at the time? And this is for any of you. And how did you manage to continue your employment and be running around getting all these treatments?
I was working actually through August of last year. And again, when I was doing Surspheres or IMC, like IMC-A12 was every 2 weeks. It was just a single day, would run down there. When I was doing immunoembolizations here for a few times again, the nice thing about the liver-directed treatments is, so we would fly in, if we had the doctors, we would get a treatment on Monday, Tuesday, or maybe a Thursday, Friday. We would literally fly in the previous night, go into the hospital, go to the hospital at 6 a.m., be treated, and leave the next day.
And just go right back?
Yeah. I think this is the case for, as I understand, this is really the case for most people with liver-directed treatments. Really, fortunately, I think the side effects have been, they've been very minimal. They've been minimal for me, but I think they've been minimal for quite a few other people too. So, and then when you have scans, they've been very accommodating. Like scans on Sunday, so we'd fly in on Saturday, we go to the hospital to be scanned on Sunday. The doctors visit on Monday, have the treatment on Tuesday if everything works out.
How about your energy while all of that is going on? I guess you run and you eat, and as you said.
In general, as far as what I've experienced, and it's very, but in general, it hasn't been really that bad at all.
Okay.
The first week after you do any liver-directed treatment, whether it was immuno or chemo, you have the incision, so you're not supposed to do any running or anything like that. And then, I noticed that, then it'd take you a couple of weeks, for me at least, to kind of get back to. By no means was I couldn't move around. I was fine, but as far as my running, it would take about 2 weeks in my case to kind of get back to where I was.
Okay.
And then you start back all over again when you do the next liver-directed treatment. So honestly, like I said, I feel very fortunate that there are times where we might have a trip planned, and 4 days after we got done with the particular procedure here, we would leave. And as I posted on the Ocumel board, to be honest with you, I thought the service fair was the easiest one of all. Literally came up here, did it, and, a month after I had service fears, I noticed that there's fatigue that set in for maybe I don't remember exactly, but probably a week or so, but really it wasn't that bad. And that's, again, when I was working when I had the service fears and the IMCH-12 and the first part of the immunoembolizations.
Thanks. I don't know if, well, we'll leave it. I don't know if the others, if you have anything more to say, or do you want to just go on to more questions?
Everybody else want to talk about kind of your home life?
Mine was just mainly fatigue. Sometimes I'd have a little bit of nausea, but it was a good thing that I didn't work outside the home. So I was able to take a nap every day and kind of, feel normal again and eat normal again. So.
Yeah, I had a 7-week-old to take care of, so I just blamed it on her.
Having a 7-week-old is not normal life in any way. Did any of you change your eating habits at all during your, after your, surgeries and after your IV? And so you're not
I ate
doing anything?
queso
He already eats healthy.
I ate queso flamiato only about 3 times a week instead of like 5 or 6 times a week. That's actually a very, if you're from Texas, it's a very cheesy, greasy dish. But, personally, we've always eaten relatively healthy, but by no means went on any type of extreme diet. So.
I try to eat organic whenever I can. And if I have starches, I stick to brown rice. And I do the plate of dinner, like half vegetables and like a quarter a piece of meat. I do like a half a chicken breast or something, and everything's like grass-fed or organic. And I try to limit sugar consumption also.
When I found out that it had gone to my liver, I was eating, my husband had found out that garlic was good. So I ate a clove of garlic a day. We'd chop it up and eat it, and because they said the sulfur was, good. So I was killing everyone around me with it.
Any more questions? All right.
How old is your daughter now?
She is 4. She turned 4 in August.
All right. Well, thanks so much. This is a wonderful panel. Thank you for sharing your story.
Thank you.